You want to know if you need B vitamins. You've heard they're good for your body, your hair, your stress levels, a multitude of things. And of course, they are. But how do you know if you specifically need them? Most people assume that they're going to do blood work, although very few people actually follow through and do this, and is completely useless. Testing your blood for nutrients and B vitamins specifically tell you just that, what's in your blood. But what about your tissues, the place where the vitamins are used by the body? Okay, so for B vitamins specifically, this is a major problem because you can go get a blood test and have completely normal levels of B vitamins, but be lacking them in your cerebral spinal fluid. Okay, so what that means is you go to the doctor, you go to a lab, you get your blood results, and it says normal. You're within the normal range. Unknowingly, your cerebral spinal fluid, which requires B vitamins for proper neurological function, is very low. And this is exactly what happens in patients with neurological problems, especially dementia and Alzheimer's, which we know are contributing factors from B vitamin deficiency. Okay, so how would that ever show up on a blood test? How would you ever know? How would you ever prevent these things? In fact, for years and years, decades even, B vitamins were used to prevent and maintain normal neurological function. So people who had neurological disorders, Parkinson's, schizophrenia, things like this, were treated with B vitamins. But now we don't do that. We have multi-million and billion-dollar pharmaceutical drugs that keep you hooked and make sure that you're paying and paying and paying without ever fixing the issue. But I don't want to get sidetracked. We need to look at what's in your tissues to understand if you need B vitamins. How do we do that? We're not going to take a tissue sample of your skin, your hair, your nails, everywhere that B vitamins are used, your adrenal glands, okay, your kidneys, your cerebral spinal fluid. We're not going to do that, but we're going to ask the body, and this can be done very simply and very quickly and very reliably. That's the most important part. It's very reliable because for hundreds of years, we've known what happens when B vitamins are lacking in the body, lacking in the tissues. What happens? Symptoms manifest within the body, and we understand those. We also understand that different people get these symptoms at different times, and of course, with different degrees of severity. So one person might get dry skin, one person might have neurological issues. Of course, over an extended period of time of B vitamin deprivation, okay, if you're lacking it for a really long time, you're going to end up with all of the clinically documented symptoms. But what happens before that? Before you get the dementia, before you have the neurological conditions, before you have a nervous breakdown, there are little signs and symptoms along the way that, again, we all kind of exhibit at different times and, again, different severity levels, but we get them the same nonetheless. So we're going to look at the top 10 clinically documented symptoms for B vitamin deficiency. It might also be important to say that there are many B vitamins. We can go over them all individually, but what I found in practice is that if you treat them as a whole B complex, we're going to kind of fill in those gaps regardless of which one, two, or three that you might need, because a lot of the signs and symptoms also overlap. So it's better to just group the B vitamins together. And if you find that you're lacking, well, you take a B complex and you kind of fill the gaps for all of them. So it's a little bit of a safer and easier, kind of foolproof way to do that. So let's look at the 10 clinically documented symptoms of B vitamin deficiency. Those 10 are: number 1, acne; number 2, anemia; number 3, constipation; number 4, GI or gastrointestinal disturbances. That can be gas, bloating, belching, things like that. Number 5 is fatigue. Number 6, dry hair that falls out. Okay, if you're losing your hair, if your hair is really dry, it's lacking its luster. Number 7, insomnia. I know this is very common, and yes, this is a B vitamin deficiency. Number 8, we have dry, flaky skin. Number 9, increased cholesterol levels. That can be HDL or LDL. If they are increased, this is a symptom of B vitamin deficiency. And last but not least, the one everybody knows and a lot of people do attribute to B vitamin deficiency, low energy or fatigue. So what we want to make clear is that if you're suffering from 3 or more of these symptoms, it would be reasonable to increase your B vitamin consumption, whether that's through vitamin B rich foods or through a supplement. But like I say with every video, the very first thing that you need to do, if you take this test and you say, hey, I have 3, 4, 5 more of these symptoms, I want to increase my B vitamins and, of course, remedy these symptoms, get rid of these annoyances and aggravations of the body. And you want to increase your B vitamins because, again, you want to be healthy. You want to have normal levels in your tissues. The first thing you have to do is eliminate antagonistic substances. There are substances that you're consuming, breathing, things you're doing that are causing B vitamins to be eliminated from the body quickly or inhibited. The absorption is not going to be the same. So imagine, hey, I know I need B vitamins, so I'm going to take them. And then you're also doing something else that's completely wasting them. So the first step is always to eliminate the antagonistic substances. I'm going to list those for you so you know what they are. The antagonistic substances to look out for B vitamins are alcohol, birth control pills, coffee, diuretics, infections. Okay, so they're not always just things you're consuming, but other symptoms and things that happen within the body. If you have chronic or constant, high frequency of infections, you are certainly going to be inhibiting B vitamin absorption and utilization within the body. Okay, malabsorption is another one. Overcooking your food. I know a lot of people are guilty of that. It used to be me, in fact. Sleeping pills, stress. That's a big one. Who isn't feeling stress any particular day of the week? But nonetheless, it will, deplete B vitamins from the body. So you want to make sure that your stress levels are as low as possible. And I mean, hey, I suppose that's advice for anyone at any time, not just this video. Sugar is another one. Sulfa drugs. And of course, lastly, you should be stopping this anyways, but especially if you're deficient in B vitamins, tobacco. You want to avoid tobacco at all costs. So if you are consuming any of these, if you're taking, diuretics, if you have a lot of infections, if you're drinking a lot of coffee, if you take birth control pills, this could be causing or at least contributing to your B vitamin deficiency. So, like always, I am never going to tell you to stop a medication or something that's prescribed by your doctor. I'm not here to do that. I'm simply giving you the information so you can make the best decision for yourself. All right. So now what do? Well, you're low in B vitamins. You have some of the symptoms. You eliminate as best you can those antagonistic substances. And then you want to take a supplement or you want to take vitamin B rich foods. I want to warn you though, if you take a supplement, my recommendation is actually to take a lesser dose more frequently than to take a high dose less frequently. B vitamins are water soluble. They do not store in the body. So blood levels are going to shoot up really high and then drop off relatively quickly. So that means if you're taking a high dose once a day, what's happening the rest of the day? If those levels aren't sustained, if your body can't grab those nutrients and use them where they're needed, it is much, much better to take a lower dose and do it more frequently. So the highest dose that I ever tell anyone to take is a B50. Some people even advocate doing lower doses than that. Do a B50, 3-4 times a day. Do it with food, and you're going to be much better off than doing a B100. I've seen people do a 200 in a given dose. It's not going to work as well as taking smaller doses more frequently. Now, that's the supplement side of it. If you want to just eat B vitamin rich foods, even better, because then it's going to come with other cofactors and things that help the body, not just the B vitamins. So I will list the foods that are highest in B vitamins, and you can certainly use that route if you want to. Those foods are liver, beef or lamb, always, brewer's yeast, brown rice, almonds, egg yolks, fish, poultry, dark green vegetables. Okay, you got to make sure they're dark green. Oats, sunflower seeds, seaweed, cabbage, blackstrap molasses, and of course, last but not least, lentils. So let's go over that again. I gave you 10 clinically documented symptoms. I would only want to assume that you need to take a supplement or eat more B vitamin rich food if you're experiencing 3 or more. Of course, if you just have one of those symptoms, that can easily be attributed to something else, to environmental toxins, to allergies, to another nutrient deficiency, to taking a prescription drug. Okay, so you want to make sure you have 3 or more for this test to be reliable and for you to consistently do this. Because let's assume for a minute that you have 6 of these symptoms. You increase your B vitamins, you retest yourself 4 weeks, 6 weeks from now, and you only have 3 symptoms. You keep taking them, then you only have 2 symptoms. Then obviously you're doing the right thing. Okay, so 3 symptoms minimum. Eliminate the antagonistic substances. And if you're going to take a supplement to increase your B vitamin levels, make sure it's a B50 or less and take it more frequently throughout the day. I hope this helps you. Come back for more videos. Check my channel for any of the other nutrient deficiencies and how to know if you're lacking that particular vitamin or mineral. And as always, have a wonderful day.